Okay, so I'm doing the external anatomy of the heart, and right here where my forceps are, you can see that the teeth are holding on to the visceral pericardium, also known as the epicardium. That is the external lining of the heart. Next, we have the apex and base of our heart. So you'll know that the apex is the pointy end of the heart and the base is the top. We have our right and left atria. So our right and our left atria. The right atria contains deoxygenated blood, and the left atria contains oxygenated blood. Our right and left auricles, so our right and our left auricles, these are used for kind of as reserved pouches that contain blood that is held there prior to being dumped into the right and left ventricle. And I read that it kind of acts as a reserve for blood when there is an increase in pressure. So the left side, which is over here, the left auricle collects oxygenated blood that is housed before being dumped into the left ventricle, and then the right collects deoxygenated blood. So our right and left ventricle, our right ventricle is noted here. It is anteriorly to the interventricular sulcus, and so it is superior to the interventricular sulcus, but inferior to the right atrium. Next, we have the left ventricle, and the left ventricle is noted on the opposite, so the lower part, so inferior to the interventricular sulcus, and then also inferior to the left atrium. Our interventricular sulcus is noted right along here, going all the way down, and it kind of forms a V shape. So if you come all the way down this way and then you come around this side, it notes a V. So it kind of looks like this, and that's how you'll know that this is your interventricular sulcus. Next, we have our pulmonary trunk, and my sheep kind of already came pre-cut, so I didn't have to do no type of cutting to remove some parts of the fat or anything. Everything just kind of sits exactly the way it looks. So pulmonary trunk is here where my index finger is, and the blood that is coming from the pulmonary trunk is being dumped into the lungs, and it contains deoxygenated blood that will be dumped into the lungs, and then it will come from the lungs and go into the pulmonary vein, which is noted here. So deoxygenated comes from the pulmonary trunk, goes into the lungs, comes back out into the pulmonary vein as oxygenated blood. Next, we have the aorta, and the aorta is noted right here where these forceps are. So the forceps, and you stick your finger right in here, that's the aorta. So it was cut really small, so I don't have the ascending aorta or the arch of the aorta. So I'm kind of use my index finger here. So if this was my aorta, the ascending aorta portion is a section between the heart and the arch of the aorta. So this here would be considered the ascending part, and this little arch here would be considered the arch of the aorta, and that's the peak that looks like an inverted U. So right there. And the brachiocephalic artery is noted back here, and the superior vena cava and inferior vena cava. If I flip my heart over, you'll see that the superior is noted here, and inferior part of the vena cava is noted here, and it my probe goes in and out from there. The coronary sinus is noted to be alongside here, and the blood that comes from these three major vessels is being dumped into the right atrium. So they deliver deoxygenated blood that is being pumped into the right atrium, and it's a collection of veins, not arteries. So once again, superior, inferior vena cava, and the coronary sinus are a collection of veins that contain deoxygenated blood that is being dumped into the right part of the atrium. Now we will move on to the internal anatomy. I will go ahead and make my incision and then report the second half for my video.